One thing I don't think we've heard though is what are the challenges? We've heard a lot of about what's been moving forward and the progress that's been made. But I'd like to hear a little more about what challenges remain. I'm sure there are many. And then we can open up to the audience.
Clark County is on the cutting edge of major changes. The last 5 years and the next 5 years will lead to more activities than in the whole last 75 years. We're going to be one of the top leaders in the state of Ohio. We already are with our innovations and our creativity, and there's over $600 million in projects going on in the central Clark County area. City of Springfield is the heart of it all. It has been since 1818, and I see major positive things happening. You come back and sit in this room in 10 years, and you will be astonished at what these gentlemen have accomplished. And coming from the private sector, where our family has been in the downtown business for the last 84 years, this is good for all of us.
Thank you. And Mark Wiener, if you have your opportunity to speak before we open it up.
I was hoping not to say anything after Dr. Adelman's. To add really to Rick's comments and really to complement some of what Tina said is the hospital is obviously very excited about the many different aspects of benefits that we're going to realize as a community with the new medical developments going on downtown. But to speak to Tina's point, we just recently launched a new, we call it an employee or associate benefit, but it's really a community benefit. And that is where we are providing financial assistance to any employee of our organization who chooses to buy a first home, meaning they have to be a first-time homeowner in Clark or Champaign County. And the mayor and I were just talking about that before the ceremony started. And it's a pretty emotional experience to be in a small home that's obviously bearing the blood, sweat, and tears of being renovated and improved. But it's the essence, I think, of what we're talking about here this morning, and that is it's revitalizing our downtown. And we've done that for one employee, and we have, not surprisingly, have a host of other employees that are now in the process, if you will, with the pipeline, and they have to go through a fair amount of training and preparation, because the goal here is not just to put people in houses for the first time, but it's to keep people in houses for a long time. And I think that's a key ingredient for really the success that we're talking about. The other thing I want to add to, as far as the excitement of the hospital project, is think beyond the opening day of the new hospitals downtown. And I go to the other end of the podium and to Mark's comments. I think it's equally exciting, and it's as a relative newcomer to Springfield, I think it's almost a once-in-a-lifetime opportunity to have new hospital downtown and let our private university literally double in size. So when you think in terms of the benefits that this community is going to realize by virtue of having the former Mercy Medical Center campus because it's immediately contiguous to the campus of Wittenberg, I think that's an opportunity that Springfield, to the credit of the planners, is absolutely necessary to capitalize on. So it's very exciting.
Mark's trying to make a deal right here at the stage. The question was, what are the problems? The reality is, and Mark can certainly speak to this, building a hospital downtown is a lot more complicated than building it out in the green area. And those of us in the city can certainly attest to that too. The amount of time and effort that we've gone through to make this project possible has really put a tremendous amount of stress on our staff, but it's a sign of how important we think this is for the city of Springfield, that we've committed as much time and effort to see this happen. And at the beginning of the process, we probably didn't have a clear idea of just how much work it would be, both for us and for the hospital. I think it's going to be a magnificent result, but it takes a lot of effort. And the simplest thing, which the consultants told the hospital, was to go out and build in a cornfield somewhere. And the fact that we were, as a community, came together and helped the hospital make the decision to go downtown, I think is going to pay off in great ways. But it's not simple. is complicated.
You want to add anything to that? You know it's complicated though, right?
As far as some of the challenges, obviously in the area of economic development, education is the number one thing that comes up. So as Mark Erickson alluded to earlier, it's eds and meds. Education, we have an urban school district. It's one of the larger urban school districts in the state of Ohio. So we have urban issues related to that school district. And I can say there's a lot of effort going into that school district through P16 and others, as well as the school board and Don Thompson, and working on those gaps that are in our educational system. But it's the number one reason why we have out-migration from our community out into our county. We typically, I think you said earlier, 9% is our loss as a community. That loss has been to the county. It's not been outside of the county. Our county population statistics have remained relatively flat, maybe 1% decline. So the out-migration has certainly impacted us, and that's been attributable to the educational system. So we have to turn that around as a community, and that is one of the number one issues we're all working on as we move forward. We have all these new schools, $166 million invested. Now it's getting that product turned around, and they're working on that. And then, obviously, everyone's talked about our healthcare system. We have to have quality healthcare as we move forward in this community. And this healthcare center that's being constructed, as well as with the surgical hospital and the other areas related to healthcare, is going to help us as we move forward as a community. Because we are focused on downtown as a community. I believe we're going to make that a hub again. But we have to have these other assets working for us as well. And so that's going to be a key ingredient for us as we move forward. And we can't have a smart decline approach. I don't believe that's the right focus for Springfield. It has to be the smart growth. She uses right sizing. What is the right size for Springfield? I think it's slight growth. And I think as we develop the downtown as a unique asset for our community, as we continue to see the Bechtel area develop, we see the eastern corridor develop, we're going to have a nice triple threat as a community, because we are well situated within our region, we are well situated within the state of Ohio to grow jobs and to grow as a community again, because they certainly do not have the quality of life that we have in other areas of the state. And we can provide that to our citizens and to the opportunities for growth as we move forward.
Okay, let's have some questions.